Hello and welcome to JA Explained. This is an episode all about juvenile arthritis pain and how you as a caregiver or parent can help your child or loved one better manage it. I'm Corrine Pinter. I am an active volunteer at the Arthritis Foundation. I have a daughter, Emily, who is 15, who is diagnosed at 2 with polyarticular arthritis, and she currently has psoriatic arthritis. So I understand how distressing it can be to watch your child struggle in pain and feel like there's nothing you can do to help. Our guest today, Dr. Cara Hoffart, will share advice on how we as caregivers can help our loved ones live better with pain so that we in turn can all breathe a little easier. Dr. Hoffart is a pediatric rheumatologist and director and founder of the Rehabilitation for the Amplified Pain Syndrome RAPS program at Children's Mercy Hospital in Kansas City. It is one of only a handful of pediatric pain rehabilitation programs in the country and helps children with chronic pain redeem their lives through functional approach. Additionally, Dr. Hoffart serves as director of the Pain Management Clinic at Children's Mercy and is an associate professor of pediatrics at the University of Missouri, Kansas City School of Medicine. Dr. Hoffart, welcome.
Thank you for having me.
What are some of the processes of, okay, they have pain, so now what? It's not the arthritis, but it's left over from the arthritis. Where do we go from here? I think is kind of
Absolutely. Yes. I'm going to refer to this nerve pain as amplified pain. So that's what we tend to call it. A lot of rheumatologists use the term amplified pain. A lot of pediatric pain centers use that term. It's also known as central sensitization syndrome, nociplastic pain. So it has a lot of different terms associated with it. Also, I tend to use this term amplified pain syndrome. And so, which I mentioned is this overactive nerve condition, and it involves a lot besides your nerves. So it's overactive nerves. It includes your blood vessels. There are genetics of pain. We know hormones play a role in pain. We even know the immune system plays a role in pain. When you look at populations of people with chronic pain, parts of their immune system look different from people who don't have pain. So there are just so many factors to consider. And so normally, as I said, when your underlying mechanism for pain is treated, your nerves should turn off. But in this sense, these nerves continue to fire. And so normally when people have pain, we say, oh my gosh, that hurts. Well, you should rest. You should take it easy. Don't do that anymore. And if you sprained your ankle, you should rest it. But this type of pain, because it's a nerve pain, our approach to it is very opposite. And so our approach to this type of pain is if it hurts to do something, that's what you should do. And so basically working to retrain your nerves to know what normal is. And so if you start walking, so assuming your arthritis is under control and this is the nerve pain, if you start walking for a long time and your pain goes up and you quit walking because it hurt, you just told your nerves, good job, guys, high five, walking super dangerous. Next time you walk, send a huge pain signal again to make sure they stop walking. On the flip side, if you start walking and your pain goes up and you know it's this amplified nerve pain and you keep going because you know it's not dangerous. Yes, it hurts, but it's not dangerous. And you keep going. Now you're training your nerves. Walking's not dangerous. You're the boss and you're going to walk no matter how much they yell at you. And you're actually going to start to retrain them by doing more functional activity. And what we know about this condition is that function comes back before pain can go away. Function means being able to walk a long time, being at school every day, doing your chores, hanging out with friends, playing your sports. All of that's function. Function comes back before this type of pain can leave, which is really unfair. Ideally, pain would leave and then you would do all the things you want to do. And sadly, that's not how this works. You have to do normal activity in order for pain to go. And then the homework of it is actually, one is exercise. And so I do send most of my patients to physical therapy to work on home exercise plans that include a balance of strengthening and aerobic activity, and to do exercise pretty much every day. Exercise is great for treating pain. Exercise is great for arthritis. It's good for your immune system. It helps you sleep better. It's good for mood. So getting that daily exercise and activity is really important. A lot of my patients might even have pain to touch or to pressure. And so we do desensitization if that's the case. So basically rubbing, patting, massaging areas that feel painful to touch or are tender. And then We also know that there's this clear physical side of chronic pain conditions where there's an abnormality in the way that the nerves and the blood vessels are firing and connecting with the brain. But the other piece that's really important to know with pain, no matter what the reason you have pain, being in pain all the time is an emotional experience. And no
Mhm.
matter how tough you are, being in pain all the time takes a toll. And so pain alone can really increase your stress. And we know that pain increases stress and stress increases pain. And pain can make you feel irritable and cranky. It can make you sad or mad. It can make you more anxious. And so we actually then work on a lot of stress management strategies, sometimes with counseling, definitely through relaxation strategies, like even breathing exercises. So really treating the whole person, both from a physical standpoint with exercise and activity, but also stress management strategies. And frankly, that holds true for any cause of pain.
Mhm.
So
Yeah.
even if you have a chronic disease that's causing your pain, some level of activity and exercise, working on stress management helps your pain, helps your immune system. And then if you have something like amplified pain, we just crank up the dosing and the intensity of those things.
So piggybacking onto that, what should I do in the case of a flare up or my child's condition is active or worsening? I mean, is there something we should do or stop or, now what? She's in a flare or this is making her
Mhm.
worse. What do we do next?
Yeah, so with an actual arthritis flare, it's different. And this is where it gets confusing because basically I'm saying with amplified pain and nerve pain, don't listen to your body, do things even though it bothers you. But when you're, within reason, of course, but
Yes.
with arthritis, you definitely want to pay attention to your body. And so I don't bar my patients from doing anything specifically when they're having an arthritis flare. Obviously we're working it on the back end with their medications and adjustment, but that can take time and that can sometimes be frustrating to find the right medication. And for whatever reason, you might have been on something forever and it just quits working.
Mhm.
And then we do have a stepwise approach of how we start looking for the right medication. But I know it can be a frustrating process to find the right thing. And everything you start, you have to give it a couple of months to see if it's going to work. And so that, takes a lot of patience and there can be a lot of pain in the meantime. And so certainly we have adjunctive medications like, anti-inflammatories. And so talking with your doctor about things like that. But otherwise, still being somewhat active is important, even if you have a flare. So not just laying in bed, but nor do I want you like, running your track meet probably. But I do have some kids that still decide to like maybe be in their PE class that day, but they listen to their body and they rest when they need to. And so we make sure our patients have 504 plans for school. So the schools are aware of what's going on. And there might be days that they have to, sit out of something, or maybe they'll do part of the activity, but not all of the activity. And so even during a flare, to do some level of activity, you're not going to damage anything specifically by doing that. And doing stretching and still having some activity is important. And then there are just things to do that can be helpful, like heat. So, heating pads, Epsom salt baths. Some kids like ice more, but some prefer heat. So just trying those types of things, massage, relaxation strategies still go a long way with calming your sympathetic nervous system and building up your rest and digest parasympathetic nervous system. So even breathing exercises or meditation or coloring or drawing or listening to music, those types of things can still be beneficial towards pain. And so there are a lot of different strategies out there to try to at least make you more comfortable while you're waiting for the right medication to kick in.
This is I probably feel like as a parent is probably the most important is how can I effectively communicate with my child's healthcare team to ensure the best pain management plan first? And then when should we consider more of like a pain rehab program, like the one that you operate? And what exactly in rehab centers?
Yeah. I think I believe all providers really want to have open communication with their families, and so whether it's at the visit or if you need to, send a message in between, and I think just really being open about what you're worried about, and what the concern is. Because I think I've even been guilty at times that maybe I didn't fully understand like where the question was
Mhm.
rooted,
Yeah.
and like what the worry is. And so I think all of us trying to get to the bottom of that. And what the fear is. And I think for me, I really bucket pain into dangerous versus not dangerous. And I think that can kind
Mhm.
of help move forward and when it's safe, to move through things. And hopefully through avenues like this, families are learning more about the different types of pain so they know more about what to ask.
Right.
And so because I think sometimes a rheumatologist can conceptualize like I take care of inflammatory pain, and then they don't necessarily go into the other types of pain, but they certainly know how to.
Right.
And so kind of pushing that a little bit, and do you think it could be and like an amplified pain or something like that. And you can have more than one thing happening. You can even have active arthritis with amplified pain on top of that. And so then you have a very multidisciplinary approach that needs to happen. So continuing those open communications, writing your questions down before you go.
Mhm.
Sometimes it never fails. You get into the office, and then you're like, I forgot what I was going to ask about. So
Right.
I love when my teenagers have questions.
Mhm.
So even I think really empowering your teen or child to write down their questions before they go. And so they'll pull out a list on their phone, which I think is
Right.
so awesome. Making sure that everyone, gets their questions answered. And most patients end up not needing intensive pain rehab programs to treat
Mhm.
amplified pain. So there are a handful of intensive multidisciplinary pain rehabilitation programs across the country. So we have ours here in Kansas City. There are certainly some kids that get treated in rheumatology clinic with their chronic pain condition, and they get better on their own doing physical therapy and exercise and
Mhm.
stress management and maybe counseling. And then the kids that just aren't getting better on their own, or if they're missing out on a lot of activities, they're missing school, their pain's just not getting better, they'll send them over to our pain clinic. And even with the kids I see in pain clinic, only a third of those end up going into pain rehab. So the
Mhm.
majority of patients actually do get better of this on their from this on their own, doing the outpatient work. But certainly, if you are not making headway with this outpatient plan, and you just need sometimes more intensity, more dosing of these things, or a team of people that just knows how to
Mhm.
do this, and this is what we do.
Yeah.
And I also think sometimes too, when you have underlying medical conditions, it's harder to know what's safe to do. And so then you end up not pushing yourself as much as you need to because you're worried. So then sometimes being in a setting where you are with PTs and OTs and physicians all day long,
Yeah.
so then you really know we're able to help you figure out what's safe, when you should pull back. And so I think some kids need that to move forward as
Mhm.
well.
Mhm. And I think that's the biggest thing is there's options. Like there is a process of, and like you said, a lot of times a rheumatologist can treat it. And if they feel like it's out of their wheelhouse, they'll refer
Mhm.
you. And then still, if there's no progress, there's more. So there is hope of that progressively there's steps to this and that
Yes.
it can be resolved easier for some and not for others. And that's okay, but there are resources. And I was thinking of this as you're speaking, yes, I've been around this for 13 years. It's a long time and have a very well
Mhm.
established relationship with our providers. Where if you're a newer diagnosed or only in it for maybe a year or two, you may not feel that comfortable yet. But at the same time, you're advocating for your child and trying to get the answers too. So as much as you can communicate, it is helpful and your questions aren't dumb. And I think a lot of times families might feel that way is that, well, I'm asking such a dumb, simple question.
Mhm.
No, that's where we're at. Like, I think you appreciate that as a provider, even us trying to get more answers, even if it is simple, we're overwhelmed sometimes and very emotional and maybe frustrated that we might not think we're thinking clearly, that you just need that reassurance of it's not a silly question. Yeah, it might be simple, but good. What if it is a simple solution or a simple answer? That's sometimes better than not getting an answer at all and questioning.